pre-adolescent kids, tweens and teens are flocking to Sephora, Ulta Beauty, all these retailers to purchase really expensive skincare. So Gen Alpha is spending more on skincare than even we are as their parents. And it might seem kind of harmless when you think about it at first, but there are some true pitfalls here, because when children as young as 8 are using anti-aging products that are not meant for their skin and aren't necessary, they can end up damaging and harming their skin barrier. Another trend I've seen over the past 2 to 3 years is something called the Kylie Jenner trend. Kylie Jenner has been blessed with very full lips, but teens are trying to emulate this in a dangerous way. They are using a bottle to suck into to try to create edema and swelling of their lips to mimic these larger, more full lips. And unfortunately, that can lead to harm, swelling with the lips, a lot of bruising around, and even lacerations if the bottles tend to break. So it is definitely something to think about if you see a child or an adolescent patient with bruising around the mouth. Here's what I say to my patients. In general, at that age, in the tween ages, between say 8 and 12, the basics of skincare come down to gently cleansing your face once or twice a day, perhaps using a moisturizer. I always prefer to use things that are not irritating, so something fragrance-free, hypoallergenic, and then absolutely establishing a good rule for sunscreen early on is a great healthy hygiene habit to get into, protecting themselves from the sun. So that's it, the basics. A gentle cleanser, a moisturizer, and a sunscreen for our tween patients. They certainly don't need to be using harsh acids, scrubs, or retinol.